First, wash your hands. In order to select the vein, apply the tourniquet to the arm. Select a vein that's full and bouncy and soft, and it should refill when depressed. Avoid using the antecubital veins, as this will restrict the patient's movement and increase the risk of complications. Once you've decided on the vein, remove the tourniquet. Ensure you have all your equipment ready. You will need a safety cannula, a 10 ml syringe containing 0.9% sodium chloride to flush, a sterile transparent dressing, your disposable tourniquet, and a sterile dressing towel and plastic bag. You'll need an alcohol cleansing solution, either solution or a swab, to clean the skin. Open a sterile pack and add appropriate equipment to the tray, or otherwise create a sterile field to place under the patient's arm to create a clean working area. Reapply the tourniquet and, if necessary, repalpate the vein. Clean the skin with 70% isopropyl alcohol for at least 30 seconds, using strokes back and forth with friction. Allow the solution to air dry. Apply alcohol gel to your hands and put on gloves and an apron if required. Remove the cannula from the packaging and check it for any damage. Stabilise the patient's vein by applying traction to the skin. Remove the cover from the needle and ensure the cannula is in the bevel up position. Insert the cannula through the skin at a shallow angle between 10 and 40 degrees. Ensure the cannula is in the bevel up position. Insert the cannula through the skin at a shallow angle between 10 and 40 degrees according to the depth of the vein. Wait for the first flashback of blood into the flashback chamber of the stylet. Level the cannula to a lower angle so that the cannula can enter the lumen of the vein. Loosen the cap on the end of the stylet and withdraw the stylet slightly through the cannula. You'll see a second flashback of blood along the shaft of the cannula. Maintaining skin traction, slowly advance the cannula off the stylet and into the vein. And then release the tourniquet. To remove the stylet, apply pressure to the vein above the cannula tip. As the needle's withdrawn, the safety device may activate itself. Use the cap to cap off the cannula and dispose of the stylet into a sharps container. Use the syringe with saline to flush the cannula. Use a push and pause technique to inject the sodium chloride into the cannula. This creates turbulence that will remove blood from the internal wall of the cannula. Observe the site for signs of swelling or leakage and ask the patient if he or she feels any discomfort. Apply an appropriate dressing, such as a moisture-permeable transparent dressing or sterile gauze, and include a date label. Ensure the patient's comfortable. Dispose of the waste. Remove your gloves and apron. And wash and dry your hands. Be sure to document the procedure in the patient's notes.